Okay, David, let's look at your knee problem. Once again, it's a medial tibial pain that you're getting?
Yes.
And you get that when you do leg extensions?
Yes.
And how about when you squat? Not too bad when you squat?
A tiny bit when I squat.
Okay, do you find that you change the position of your right leg to accommodate the squat? Do you find that you're not symmetrical both sides?
Yes.
You do?
Yes.
All right. So let's do some examination of that knee. Lay on your back, please. All right. Earlier we did some muscle testing on you to determine whether you had problems in the upper part of your body. But let's do the lower part of your body now, okay? So remember, no biting down with your teeth. Pull back, please. This is a rectus femoris test. You're able to lock the muscle against my arm. I'm not trying to overpower you. As long as I feel the lock, that's all that matters. We're going to just test you for disorganization, neurological disorganization. 2 devices in a line along the conception vessel, and you go completely weak. All right? Pull back. And you can't lock it, can you? Right, well that's normal. So now we're going to check you for polarity, and now pull back please. And let's try once more, try. No, nothing there. All right, so that's fine. That means you're normal. All right, so we're going to do an injury recall testing on your knee. Let's see whether or not you've had an injury to your knee that your brain has recorded and stored, all right? And for the heck of it, let's test your left knee first, all right? And we'll test your left knee and ankle. So I'm going to place one on the medial part of your knee. Pull back, please. Okay, now lateral. Perfect. Medial ankle. Nothing. And we'll do the lateral part of your ankle. Those are the 2 most common spots that you'll go weak if you have a previous injury. Now I could use this knee to test this knee if I want to. Okay? Let's see. Pull back, please. And now on the lateral part of your knee, and now on the medial part. Oh, what happened there? You're weak. Okay, let's use this knee to test it this time, okay? Pull back. We'll go to the lateral part of your knee. And now I'm just going to reach and place it over the medial, and you go weak. All right. So from what we know about injury recall, that when you traumatize any joint in your body enough, your brain records that trauma and memorizes it, and then it adjusts your body's musculature to adapt to that, all right? So if someone is hit hard between their shoulder blades, let's say, and they're hit really hard, the reaction in of their body will be to go like this, right? And so that pain, that sudden pain is perceived at one part of the brain, we believe the cerebellum. The reaction response is initiated from the motor cortex. And so you have this pathway between the cerebellum and the motor cortex that becomes embedded in your nervous system as a memory, and it's always there. And so patients who have had that problem, and I'm just using it as an example, will always be just a little bit tense because their brain is always trying to keep them tense between their shoulder blades because they've had a trauma that's been stuck in the hard drive of their brain, and it just over and over it's repeating itself. I must keep tense, I must keep tense, because it's been traumatized in the past. Now I don't know what happened to the medial part of your knee here, but when I place a device on it, it doesn't matter which arm muscle I use or leg muscle, you go weak, all right? And that means you have what we call an injury recall on the medial part of that joint, all right? So the correction for that is simply taking one device and laying it over that area of where the weakness was found to be, and place another one on the talotibial joints just for a few seconds. Doesn't take long. And now we can retest. I'll take this and place it back onto the medial tibia. And you know what? It's not that much better. It's not better. All right. Very occasional, a patient will have to have this done 3 times. Up to 3 times. I've never seen it more than 3 times. Okay, so I've done you twice. Let's see if it makes a difference. All right, here we go. Pull back, please. There we go. All right. So that's working. Now, typically there's an associated joint disconnect. That is, the nerve receptors in the medial aspect of your knee are not connected to your motor cortex very well. So we're going to test that. To do that, we place one on the central line of your body. Let's do the left knee first. You're going to just test the medial, nothing. And now we'll test the lateral aspect of the tib fib, and now the ankle, and now this lateral ankle, nothing. So let's do lateral knee. Let's do medial knee. All right, what's happening to you there? It's not working. Okay. Now, that means you're disconnected. Now, it's not the same as injury recall. To test injury recall, we place that device over here and only use one device. Pull back, please. We already fixed that. What we're finding now is that you have a disconnect between these proprioceptors and the central nervous system. So to correct that, I could chiropractically manipulate that knee from medial to lateral, and that would correct it, and this test would be negative. And I won't do that today. I'll just use this technique. The resonance from this device going through your nervous system meets the resonance from this device at your motor cortex, and those proprioceptors embedded in your knee reset just as if you've had a chiropractic manipulation. So let's test it again. One device here, and now it's working. Okay? I'm curious to see whether or not you actually got a problem on that right ankle as well. So first thing we always test with the right ankle, his ankles are very susceptible to injuries that stay in the nervous system. We'll take one device and just place it here. We'll use this previously strong muscle, and it's good on the outside. Okay, let's try the inside. No, not so good on the inside. See how weak you are? So do you remember rolling your ankle at some point in time in the past?
Possibly I might have.
Yeah, it's very common. It's very common. So medial ankle, we know it makes you weak. So we'll just take a second device and place it over your talotibial joint on that side while we're testing the medial, touching the medial ankle with another device. We'll do it on the other device, on the other joint as well, to send a signal up through your brain. And now I'm going to retest you. Very good. All right, we know that we've removed an injury memory or a recall of an injury. Okay, let's see if you have a disconnect here. And the reason I'm checking that is because you've had a chronic knee injury for 6 months, which probably causes you to pronate with your ankle. Plus you had a previous injury memorized in your nervous system from that ankle. Let's see if you've got a disconnect in that ankle. And you sure do. You know how weak you are? Again, if I take this away, nothing. But if I put it back, okay. All right. Do you see what happens?
Yeah.
All right. So this time, instead of resetting you with the devices, I'm going to reassess this manually. All right. And I can tell you that you have a restricted talotibial joint here, medial aspect. And the chiropractic adjustment for that is just that. All right. Did it hurt? Mm-hmm. It did hurt? Okay. So let's bring this back, test you for the lock, and the lock's not there anymore. All right? The disconnect is not there. So what we do as chiropractors is stimulate the proprioceptors really hard, and it resets the connection to the brain. Or we can just simply take a device, cat device, touch one on the locked joint and another over the motor cortex, and it will reset it. Okay? Good. All right, so very quickly, because I know you've got a right-sided knee problem, a right-sided ankle problem, I want to see if you have an SI problem on your back as well, in your back as well. So I think we'll go to the left side first, all right? So I'm going to take this, I'm going to place it right on your left sacroiliac joint, okay? Right over your left SI. Now, I want you to pull back, please. Okay, so we know it's connected well, all right? The receptors in that joint are working well because you're strong, all right? Now I'm going to take the right SI joint, I'm going to place it right here, okay? It's right on the SI joint. Now we're going to see if you're connected. We could see if you've got an injury first, all right? So we just use one device. Now pull back, please. No, you don't have any injuries to that SI joint. Let's see if you've got a disconnect of that SI joint. Oh, you sure do. Notice how weak you are? Yeah. So, as a chiropractor, I could turn you on your side facing me and crack that joint, but you'd probably prefer me to just reset it the new way, right? All right. So, because you're a bodybuilder, I'm going to show you something that you'll find very hard to believe, all right? Because I know you've got this, and I know you're a bodybuilder, you want all your muscles working optimally, correct? Now here's what typically happens when you've got a locked right SI joint, all right? Or left SI joint. So sit up for me. Good. Now, I want you to put your hands across here like so, and I'll test your rectus abdominis muscles, and you can lock them quite nicely, right? Remember, no biting down. Now we're going to do the obliques and the transverse muscles. So I'm going to push from shoulder to shoulder, and I want you to just hold there as I push you. Pretty hard to beat you, okay? All right, turn your body the other direction. So this is where I usually offer $100 if you can resist me. You want to go for that?
No.
No, okay. All right, see if you can resist. Okay. So I'm holding these down, so you should be strong. Turn your body, and now resist, and you can't do it. I'm hardly pushing at all.
Yeah.
Because you can't engage your obliques and your transverse muscles, abdominal muscles, when you have an SI problem. All right? So you do a lot of deep squatting and everything, right? Okay, turn over. I want to show you how your squatting muscles are working or not working. All right, so first thing I'm going to do is test your, just hang them down like this. I'm going to ask you to lift your legs straight up, okay? Just this left leg, okay? Lift it up in the air, and I want to test your glute max, okay? And I'll resist as I push. Good. Now what happens when you lift this one up in the air? Lift straight up. Okay, the first thing you do is turn your toe outwards, all right? I want you to keep your toe straight down, because that's glute max. Now, big guy like you, I should have no trouble. You should have no trouble resisting me. Hold that there and resist. But nothing, right? All right, turn your toe outwards now. Now lift your leg up. Okay, and now you're able to resist me, correct?
Yeah.
But as soon as you turn your toe downwards and engage the gluteus maximus muscle, hold there, you got nothing. All right, you can turn over now, please. So what do you think is one of the most important muscles for doing squats? Glute max, right?
Yes.
Okay, and your glute max on the right side isn't working properly because your right SI is turned off. All right, so let's switch your right SI on. All right?
All right.
All right, so to do that, let's stand you up. Okay, and we'll turn you this way. And I know your right SI was turned off, so I'm going to take one device and I'm going to place it over your right SI while another one is over the motor strip, over your motor cortex. Okay, perfect, just like that. And now I want you to lie on your back, please. Okay, so let's see what happens now. Sit up for me. Okay, put your hands across, turn the body this way. We know that's good. Okay, now turn the other way. You want to bet $100 now? Okay, turn your body this way. Hold there as I push. You should have bet the $100. All right, so now lie face down. We're going to do the gluteus maximus. On your tummy, please, face down. Okay, so David, you remember how weak you were with that right glute when you're, okay, let's see what happens. Your legs toe straight, okay, keep your leg up, resist, and you're strong. You feel difference?
Yeah.
Okay, you can hop up. Right, so that's just a little example of how important it is to have the nerve receptors and your sacroiliac joints functioning, talking to the actual motor cortex, because otherwise the motor cortex can't respond and make these really powerful muscles work properly. So imagine you've got, I don't know, 350 pounds on your shoulders or something, and you do a squat, And you need this muscle to fire optimally. You need these obliques to fire optimally. And of course they don't, simply because the receptors are not talking to the brain properly. So we saw that the individual muscles were weak. And now that we switched you on, you will probably stay strong. So I'm going to give you some devices later. But what I want you to do with the devices, if you want to stand up for me, I want you to, I'll just turn sideways a bit. I want you to hold the device on the top of your head, right, like so. And I want you to rub the other device over your right SI joint every day, okay? Can you do that for me? Just take it and just rub it over your right SI joint, because that's your chronic problem, okay? And because you've had this for a long time, I want you to rub it over the medial part of your knee as well. So right on the anterior tib fib area, right here, right in the inside, okay? And that will help to reset you. Now, what else did we find on you in an earlier, when we tested you earlier? That your occiput C1 is another common fault. So you want to hold one here and then hold another device there. And all you have to do is hold it in these 3 places for 5 seconds, once or twice a day, and you will reset yourself just as if you had a chiropractic manipulation. Sound good?
Yep.
Well, thank you very much.
No problem.